And welcome to 152 Podcast. I'm Jayne Williams, your host and the CEO of 152 Harley Street. And you're joining me today with two more of our prestigious consultant clinicians who are leading the way in cutting-edge treatments and therapies for patients who require plastic surgery, burns management, and all sorts of other dermatological and skin disorders. But we're lifting the curtain on 152 Harley Street to show you a little bit of an insight into what we do here. And I'm delighted to welcome today RuthAnn Fanstone and Ioannis Goutos. And I'm going to ask Ioannis first, if I may, to tell us a little bit about yourself, your career, and how you got here.
Great. So, Jayne, thank you very much for hosting this. This is a great initiative. And thank you for the introduction. So I'm a plastic surgery consultant. I did most of my training around London and the Oxford deanery regions. And then I embarked on a number of fellowships. I started off in Tokyo, Japan.
Wow.
And then I went to Vietnam, India, Nepal, and also various places in Europe. I actually started my specialist career at the London Scar Clinic following the very kind introduction from RuthAnn Fanstone. And clearly our history goes back many, many years, and I hope we will be able to talk about this during this podcast.
A dynamic duo.
Absolutely.
RuthAnn, welcome.
Thank you very much. So I'm actually a physiotherapist, and often I find that when I say I'm a physio, people are expecting that I know how to treat backs or sports injuries, but actually I've specialised in scars and burns now for a long time, and I don't think I'd know how to treat a back or a sports injury, although that's actually what drew me into physio. I wanted to be a sports therapist, and I was an athlete at the time. But then as I did my training, I encountered burns patients, and I was just struck by the assault of that injury on the psyche and the body of a person. And I was drawn in, and that was it. And from that point, I just, I've chased an understanding of how to treat people with burns. And unfortunately, many burns do leave scars. And then that opens up the whole world of scars, which do come from other causes, obviously, as of surgery and a whole host of reasons. But scars is what I've specialised in. I've worked within the NHS, within a private sector, within the charitable sector, in the UK, and I think in about now 14 countries around the world.
Wow. So you're both really well travelled.
Yeah, it's
and here we are
to learn by travelling.
Absolutely.
I think. Yeah.
Yeah. And I think what's fascinating about talking to all of you is you mentioned, you were a physio, but actually don't ask me about your groin strain or your bad back. The importance of some of these particular therapies that no one would think about with a burn, how important it is, the physiotherapy. And for our listeners today, could you just give a little bit of I know it's a long, probably a much longer answer than we've got time for today, but why is physiotherapy so important to these patients when they've got that type of scar from a burn or another injury?
Yeah, it's it's a very long journey recovering from a scar. Obviously, most scars start as a wound or a surgical incision or whatever it might be. So a physiotherapy starts on day one of the injury when it's a burn, and it can be a lifelong journey. But if I focus more on the sort of later stage when the scar's formed, and even a scar has a story, has a journey, scar maturation, which is the process of a scar changing, can take 2 years. So as a physiotherapist, I, without any clever tools such as the surgeons use, with my hands and with an understanding of scar, that's the main thing that I can offer, which I then translate into using my hands or directing through advice. And a lot of encouragement is needed. If you've got a scar, it's going to impact often a huge amount of your life. So in terms of what I would do, I focus on, as the surgeons do, but through different techniques, the look and the feel of the scar. So I can improve the look of a scar with my techniques, maybe not as drastically as the surgeons can, but I can definitely have an impact, primarily through softening the scar, which could make it look more smooth and less lumpy, bumpy, rigid, but also having a very important effect on how it feels.
Yeah.
So scars can feel really tight, they can itch, they can be painful, they can be stuck. And it is possible, as Ioannis and I have seen by working together often, to reduce the need for surgery through an initial, more physically oriented work that's not invasive.
Yeah. And I think you touched on it there as well, that, people don't appreciate how mobility can be affected by the scar, even if it's a little scar in your hand. You can't stretch your fingers anymore, and that can be psychologically as well as physically, can be so depressing for the patient, so hard to maybe do the job that they were doing. So I think, amazing that your therapies complement, like you say, someone like Ioannis who maybe would do a surgical procedure that's more invasive, as you say. But if I could come to you now, Ioannis, I mean, one of your expertise is in the management of some pretty awful scars. And like RuthAnn said, it is a lifetime journey. And I know from working with you recently, the way you use lasers to help people to improve their scars, which I think a lot of people at the moment are really keen to understand, because again, they don't need the surgery then if you can improve them with the lasers. Could you tell us a little bit more about that?
Absolutely. So what lasers are, they are light-based devices. In other words, they are quite sizable machines that are able to produce light of particular qualities, and then when this light is applied to the skin, it has beneficial effects. Broadly speaking, there are different families of lasers. There are lasers that are able to improve the color of certain scars, which is one of the major concerns that patients present with. There are some other lasers that are able to improve the bulk and the texture of the scars, just to mention a few of those categories. I think one of the main advantages of laser treatment is that it is applicable to a wide variety of scar subtypes and also skin subtypes. And actually, laser therapy is one of the most popular modalities we offer at the clinic.
Absolutely, and I've seen some amazing results from using lasers. But like you say, it's a long journey, isn't it, for these patients? And one of the things I know you're all very keen here that we do the multidisciplinary team meetings and using the psychologist's expertise as well to help them on that journey. But again, just for our audience, have you got a case that you could sort of discuss how the both of you would work together and the sort of management of that case?
Yes, I think we share a number of success stories with RuthAnn, just to say the least, and it's very difficult to pick one of those. But I think what might be really helpful for the audience in terms of them getting an insight into our work, there are certain things that we do in a particular way that I think makes us really unique. And as Jayne alluded to, one of the models that we offer, apart from being very specialist-driven and led, providing specialist-driven and led care, we also provide multidisciplinary consultations. So I can think of one of the many recent examples of a patient of us who had a very horrific facial injury who is still under our care. And I think we started off really well by joining our niche expertise into a joint consultation.
Yeah. So we have slightly different lenses and angles, but together it's a very holistic opportunity to assess a broad range of needs that the patient may have. Ioannis is, I think, particularly good as a surgeon to also very much understand the patient's perspective, which could be potentially very different from our perspective, especially in a short consultation.
And nobody can understand what that patient is going through, can they? So
no,
it's helpful.
Yes. And then as you've worked with more and more patients, you begin to build a sort of library of understanding of what's unseen as well as what you see. And actually, I've had a scar myself, so I do have, but I wouldn't rely on that because, you know, it's such a unique experience for every single patient. And as we know, you can have a tiny scar that has a huge impact, or a massive scar that really doesn't have a significant impact.
Yeah, I think that's really important, isn't it? And I know, talking to your colleagues previously in podcasts, they've said the same, and I've seen it here. The tiniest of scars may have the biggest psychological impact on one patient, and a huge scar may be very different for someone else. But it is, I think, what I'm always so enamored with is the way that we put the patient front and center, and then you as a team work out the best plan. And it might take a left turn, it might take a right turn, it might be quick, it might be a long journey, but all the time we're looking, and you're sort of adjusting the whole management of that patient. Like you said, like our skin, our normal skin, scars change with age, with time. They do all sorts of strange things. They don't always follow the plan you hope they'll follow. But I think putting the patient in the center, and this journey you all personally go on with the patient, is incredible. And to get that best patient outcome is amazing. I just wanted to touch on something that's very current in our world at the moment, sadly, and we're seeing an increase in young people, particularly in self-harming. And I know here at the clinic we've treated young people with scars from self-harming. And I was just wondering if there's a difference in that management of that type of patient, or because obviously there's a huge psychological piece, surrounding the actual activity of harming yourself. I just wondered if you had a different approach or your thoughts.
Yes, I would agree, Jayne, that sadly there is quite an epidemic of predominantly young people who tend to injure themselves. And it is a very interesting sociological phenomenon. And actually, if you look at the current literature, it appears that, unfortunately, this tends to be a very common coping mechanism. So we see a lot of individuals who are highly driven, highly successful in stable environments that do self-harm. And I think our London Scar Clinic is best suited to provide the best care for those patients, because as you know, our initial consults last for 60 minutes. This is pretty unique for a private provider. Very frequently we'll do multidisciplinary consultations that would involve either the psychologist in the clinic or the physiotherapist in the clinic. And during this time, patients are able to fully open up, so that we can get a good understanding of exactly the motives behind. And then what we do is we put together a holistic model of management. And invariably, this would involve some psychological support, which will go hand in hand with any physical therapy, surgical or laser modalities that we use.
Amazing. So, RuthAnn, you mentioned about wounds. Every wound is a potential scar.
Yeah.
And I know I'm guilty. If I am injured or something's hurting, I go to Dr. Google.
Yes.
And I should know better, but you can't help yourself. So, what do you think about that? Because everybody goes to Dr. Google now. And give us your sort of thoughts on how positive or negative that can be.
Yeah. I think I've been quite impacted by, in discussion with patients, understanding how much time and resource they may put into chasing treatments or outcomes or answers that they need to do with very little guidance, so they can go all over the place into, for example, I would say, as a general rule, anything that says scar removal, whether it's a cream or a treatment, would that be fair, is probably...
Absolutely.
And I mean, there's an awful thing at the moment on social media where you literally rub this cream on your face, and this poor person has really bad acne scars, and they rub this cream on, and then the next clip they're wiping it off, and they have a perfect complexion. You know, and that's out there for so many people to go and purchase this cream, which we all know isn't going to do that.
Yeah, and that happens, doesn't it? I have patients telling me, "Oh, I've got this cream." There are certain creams that are very well marketed, but if you look at the science and the evidence behind them, it's just not there. And a lot of them are extremely expensive.
Yeah.
And in my experience, a lot of the very effective creams, I mean, we spend our time looking behind the marketing into the evidence, feeling the cream, working with the patients. So whether it's a silicone gel product or a moisturizing cream, we're seeing, we're always exploring. Moisturizing creams are one of my favorite topics to explore because the hydration of a scar is so very important. Yeah. But there are certain creams that everyone will be applying, and all I can imagine, it's a very good marketing company because the evidence isn't there. So that to me is one of the actually most important things of what we do, because we are up with the evidence and the science and in contact with the companies and other users, the patients who are using these products. We can stop that journey from wasting a huge amount of time and money. And guide people, no, try this. I mean, everyone is different, so it won't be the same cream for everyone. But whether it's looking for a solution in terms of a scar treatment, that's what I think one of the strongest points for the London Scar Clinic, other than the multidiscipline team, is that we are up with the latest.
Yes.
Every time, Ioannis is he's published a lot. I manage a medical journal. We're always investigating, attending meetings, conferences. So we're always searching for more answers.
And the latest
yes
innovations that are coming out. So I'm going to put you on the spot here for our audience.
Yeah.
So top 2 creams for hydrating.
Top 2. Well, we should be getting some money for this. Maybe. I like one called Alhydrin. Mm-hmm. It's got a good evidence base. It is more expensive than, say, something like Diprobase.
Yeah.
But even Diprobase, as long as it's not a water-based cream, can be very, very effective.
Gosh, Diprobase has been around a long time, hasn't it?
I'm not so keen on the water-based creams, but that would work.
But that's great for because people can spend. We see a lot of patients come in here. Some people have spent £900 on a cream, and it's a cosmetic cream, so it's never going to give them that hydration you said was so important to keep the skin hydrated.
Such a simple thing, as with many treatments that I offer, simple but very effective. And evidence-based. So the evidence base is strong that as you hydrate a scar, you can down-regulate or reduce the production of collagen and therefore scarring.
So that stops the bumpiness in some respects.
The pliability or the suppleness, and can reduce the redness and the itch. And silicone gel has a similar working mechanism of increasing the hydration of a scar.
So that's great myth busting. And for those of us that go on Dr. Google and get sucked in by the marketing and the most expensive product, you heard it from RuthAnn. It may not be the right one for you, so really get advice. But actually, there's a couple of creams. It's all about the hydration. The other myth, lasers. So lasers are very popular. Whether you're a Star Wars fan or a serious Dr. Googler, but there's a lot of things, again, online that aren't necessarily scientific, and they're making huge claims. And I know there's even lasers available to buy for your own home, and they in themselves can burn and damage the skin. So, what do we need to know as a basics for laser treatment, and how do we get access to coming here and to use the lasers here? And we've got a whole suite of lasers. How do we guide the patient?
So, Jayne, I think you're bringing up a very important aspect here when it comes to patient journey. So, we are all immersed in, technological innovation and search engines, and it is not surprising that a lot of patients really struggle and have a very rocky journey. My recommendation when it comes to choosing a laser service is, first of all, do your research in terms of whether the particular facility has a full range of laser equipment. This is always a really good starting point, because if, for example, you find a clinic that only has one laser technology, by definition, your choices would be restricted.
Yeah.
The second and really important step is try and choose a laser practitioner and also look at their credentials. It is actually very easy to check that a particular specialist is part of the General Medical Council specialist register, if they are doctors or they're part of the nursing profession. So there are ways that patients can really do the appropriate checks. And then the third aspect is, when you have your consultation, feel free to ask what range of technologies are available. Feel free to ask for relevant literature, and really make sure that whoever you end up being treated by meets all the right criteria in terms of credentials.
That's brilliant. I think that's really important as well, because so many patients will come into a practice and think, well, I'll just trust them. But actually, they need to be asking those questions.
Absolutely.
And I think, again, one of the things at 152 Harley Street and the SCAR Clinic is that we do have that suite of lasers, but we also have the suite of excellence and specialism, and, that multidisciplinary team approach. So the patient comes to see us, and they may have come because they've researched their lasers and they think that that's the right course of treatment, but actually it may be. But it also may be a different path. But you guys as a team, RuthAnn, you were talking about the importance of hydration. Ioannis, you could operate on them, or you could talk about laser treatment. And then we have our psychologists, we have our medical tattooists. So all of you come together in that multidisciplinary team and really help the patient across that whole journey. And I think that's very unique here. And I've sat in your multidisciplinary team meetings and listened in awe as you discuss those patients, and the amount of expertise that patient is getting from that one consultation must be so reassuring, because they've got a plan, and it's not just the wound, the scar, it's the whole of them.
And reassuring, I think, for the clinicians, for us, that we're not on our own, that we have a team to work with and draw from, because SCAR is that complicated.
I was just going to say,
You can't do it on your own.
No. And I think that's really important, because I was listening at one particular meeting, and this patient had a horrific scar from a road traffic accident and multiple other injuries. But it was such a huge, complex case, and actually listening to you all discuss what outcomes were required here. And it wasn't just about getting the best outcome for the scar. It was about all the other things that needed to be thought about for that patient. And exactly as you said, one of the other clinicians said to me, it's just great having you guys together, because also what the audience probably doesn't realise is that you don't all work together outside of here. And we mentioned earlier about your travels, so the knowledge and expertise from the group, if there's 6 or 7 of you in a room from different NHS hospitals, private hospitals, global, European, bringing all that knowledge to that one patient is really incredible for them. So yeah, amazing. But I just wanted to talk about as well your travels, because we did brush over. I think you've probably covered the globe between the pair of you.
Well, I'm sure we have, RuthAnn.
Possibly, yeah.
So, why some of the countries, Ioannis? What's your favourite? Why was it your favourite? What were you doing there?
Well, it's very difficult to pick a favourite, actually. And I think what's really interesting is that it is very it's, I suppose, an expectation that once you have finished your training, you take some time out and simply explore other cultures and other medical backgrounds. So I did try to focus more on Asian countries. The reason for that is that there are a lot of burns, sadly, due to a number of reasons. And I also then focus my attention towards Latin America, because as we know, there are some great centers of excellence when it comes to aesthetic procedures. And I think the way that I would summarize my experience is I got the opportunity to get exposure to a wide variety of surgical and non-surgical techniques in different medical backgrounds. But I think as a human being, what I realized is this international traveling experience really exposed me to the joys and sorrows of collective humanity. And actually, I think this is a great privilege in terms of my maturation as a doctor and as a person, actually.
Yeah, absolutely. Yeah, and just to, like you say, the humility and humanity across the world when somebody needs that level of intervention is, amazing. And I know you've done a lot of charitable work on your travels, so fantastic. And RuthAnn, your travels, and you're about to go travelling again.
Yeah, tomorrow. But I think I would say India's got a very special place in my heart. Because that's where I encountered my first burns patient, actually, which led me on this journey. And as Ioannis said, 95% of all burns in the globe happen in low middle income countries. So by working in these places, we get to see way more patients. Not that that's why we do it, but it's just a byproduct. So in one of the hospitals where I've worked in Dhaka, Bangladesh, they have 500 burns patients at any one time. Whereas when I worked at Chelsea down the road, we had 500 burns patients, in and out patients pretty much, may be different at the moment, every year. So I've been able to treat thousands of scars through working in places like that. And these scars are way more severe than we would ever see in this country, which shows us that there is a huge amount that we do to prevent very bad scarring, because we just don't see those injuries here. And it gives you a great respect for scar, because you see unhindered what scar can do to the body. And it can, for example, if you have a neck burn, it can make your chin stuck to your chest. So scar is very powerful. We need to respect it and tell the scar who's boss, because otherwise it can be very unruly and take over someone's life. And then I would say always believing there's more. I've learned a lot from America. They have some burn units there that are well known for treating huge burns, 100% of the body being burnt. And what I particularly remember there is that sort of attitude of can do.
Yes.
It's not going to be no, it's going to be yes. And I think we both have that philosophy. We're going to find a way, because we believe that there will be a way somewhere. And I think another sort of place that has been very informative for me is France, because I've worked with Katie Piper. Yeah. I heard her story. I remember hearing her story as a physiotherapist, watching the documentary, and I didn't know her at the time, but I thought, this isn't right. I can't have a burns patient traveling to another country to have treatment that is apparently not available here. So Ioannis and I actually together have very much explored treatments available outside of the UK and brought them here, which I think is another important angle to what we do. We train, because there are too many patients to keep the knowledge to ourselves, even if that would be more strategic. We have very much focused on sharing our knowledge and training and developed courses to teach people how to treat scar. And we've seen transformation in the NHS and elsewhere through the impartation of skill.
Amazing to take that knowledge and share it. And so, like you say, scars are unruly, and you need to show them who's boss. And I love that. And I think I've watched both of you do that with the scar that the patient's presented with. So are we allowed to ask where you're going tomorrow?
Tomorrow, I'm actually going to Ukraine.
Wow.
Yeah. So as I understand, I don't have much data or information. Burns is a particular issue at the moment in Ukraine. So I'm going as a small team with the World Health Organization and the UN to 2 hospitals in Ukraine to train and treat. And so I'm not sure what
you're going to
find and what to expect, but I'm looking forward to doing that.
Amazing. And I know, as awful as war is, we learn a lot in the medical profession from war, and particularly around burns and scars and how to treat. And hopefully you will I'm sure you'll be helping many patients out there, but that information, like you said, will come back here. And help lots of people, not just at 152 Harley Street, but everywhere you go.
That's right. When you go, you always come away with more than you ever give, I find. You learn.
Safe travels.
Thank you.
And come back and tell us all about it. And amazing that you're doing that. One of the areas that's of particular interest to me personally is this massaging of scars. And it's very topical at the moment. I know it's not new, but it sort of seems to be at the forefront. And we have lots of patients here talking about lymphatic massage and swelling in their scars. And some of the scars are quite old. Could you tell us a little bit more about, what the massage is about? Why do we do it? And how can patients access that? Can they go to a massage? Somebody that does their back, can they go there and have their scar massaged?
Yeah, so scar massage is probably one of the mainstays of what I offer as a physiotherapist, and it has some amazing benefits in terms of improving what we call the pliability or the flexibility of a scar. And in my experience, it can improve the look of a scar too. But primarily it's for comfort. Not comfort in terms of a relaxing massage in a spa, but comfort in terms of the scar not feeling restricted. It's like, wearing a tight suit
anymore
all the time. That's very draining on your mental health to always feel restricted. So setting people free from that restriction through exercise, stretching, but also very much scar massage. And scar massage is something that I've explored quite deeply, because when I first encountered it, it didn't add up to me. The sort of theory behind it didn't seem to make sense.
Right.
Because if we think about what scar massage is generally, massage generally, we're increasing the blood supply often to various areas. And with a scar, especially in the early stages, you actually don't really want to do that.
Right, okay.
So I started to really explore the pathophysiology of, touching a scar, touching a skin. And that was kind of an intuitive feel that something's not right here. Rubbing this scar, which is what we very much used to do and still very much happens, is not helping. And as science has progressed, and Ioannis knows a lot on this topic, there's a concept called mechanotransduction, which actually confirms that the wrong kind of stimulus into a scar, and in my case I'm doing that manually with my hands, can actually, especially in the early stages, increase scarring.
So massage is really important, but if they get the wrong massage, that could be quite damaging.
And that, I see it like this. It's like all the time you hear moisturized massage, as though it's, you wouldn't deal out medication. Have as much as you want, however you like, when you want.
You would prescribe what you needed to have.
So for some reason, massage is sort of, it's all fine. But actually, it's all not fine. And even, I think it was 2 days ago, a Kyra sent me a patient inquiry of a young lady who'd had a recent injury, facial injury, and had been told she was looking for scar massage. And through our procedure, we ask a number of questions. When people inquire, we ask for a photo. So I had the data and the photo, and I looked at it, and massage is the last thing she needs. In fact, it could worsen the scar.
Oh, no.
So I feel quite passionate about this topic, because I think although it sounds so benign and naive, or just
simple
benign,
to do.
It can be problematic.
Yeah.
Equally, if you don't engage with the scar enough, then you're not going to transform and change it. So it's a balance, and that's a journey of understanding, not too much, not too little,
and getting to know that individual scar. So when you see a patient and you start on that process, is that a bit like if you had another type of injury and you would go and see maybe a different type of physio or a different type of doctor, but they'd give you some work at home to work on it? Is that something that the patient can then carry on themselves once you've set them up, or is that not the thing to do either? I'm just trying to envisage, it's such a long journey. Is the patient part of this rehab?
Yeah, I mean, I would advise if you have a scar that you seek advice from a scar specialist for how to massage that scar. Similar with laser, for example. I know that there are a lot of people who offer laser, but someone who's used to doing laser for scar is the person you need to go for.
Yeah, not hair removal.
Or
very
any
different.
other.
Yeah.
So it's really important to have someone who understands scars. Scars are very different tissue from other tissue. Like, for example, if you've got a sore back, it responds differently. It has different needs. And you also, as a scar specialist, you know where you're going. So if you're not used to working with scar, you're like, where's this going to look? Where's this going to end in 2 years? What's going to look like?
Yeah.
And I have an anticipation based on what it looks like
in
today,
your experience,
what it will look like in 2 years. So I'm not going to say, in 2 years it's going to be not there, or I'll have a pretty good idea. I mean, you always never know.
And I think that's also really important, is managing the expectations of the patient, because scars, unless you tell me otherwise, I don't think scars can ever go away completely. When you've damaged the tissue, you've damaged the tissue. And so I know one of the things we do here is really, really get into that in-depth psychological conversation with the patient, so their expectations are managed. And one of the things I've seen with you, Ioannis, and actually, really firsthand seen how, despite being a surgeon, your empathy and your understanding, it's amazing, because that patient feels so safe and trusts you so much. And you really, we have our psychologists here as part of that multidisciplinary approach, but your link between the physical and the psychological impact that each patient presents with makes them feel so much more relaxed and in safe hands.
Well, I'm glad you're bringing this up, Jayne, because even from my personal experience, when I'm in the process of, for example, considering any surgical treatments, I have a degree of anticipation before meeting the surgeon. I think in terms of the psychodynamics, there is always a degree of apprehension.
Absolutely.
Because surgery, by virtue of being invasive, has a rather frightening nature.
And you're out of control as the patient.
Absolutely. Well, let me bust this myth. We are plastic surgeons. I'm sure I speak on behalf of the whole team at the London Scar Clinic in 152. We have been trained to be very decisive, to be very exact in our surgical planning, and at the same time being very gentle with the tissues, being very gentle with the patient when they are asleep or either they have a procedure under local anesthetic. And I think what really separates us is the fact that we are not only gentle on their tissues, on their scars, but we are also gentle on their psyches and the whole, and just making sure that they get the best patient journey possible.
And I think that's so true. And I love the way you've said about the gentle on the tissue, because having worked with lots of wonderful experts in lots of different sectors of medicine, but it is very noticeable with plastic surgeons just how gentle you are. And I hadn't thought of it in that way before, but obviously the very nature of what you're doing, you are most definitely trying to minimize any scar and get the best patient outcome. And so it brings me on to a lot of patients we see here have had a surgical procedure, particularly a lot of women who may have had a rushed cesarean, that mum and baby are in distress, or they've been to another country and had a tummy tuck. And we've had a real run lately of people coming in here with awful, awful scars, but they're incision scars, lacerations. And I think it'd be good to get an insight into how you manage those as a plastic surgeon. How do you try and fix that to the best it can be?
So this is actually a very common presentation for a number of our patients. So they recently had a procedure and they inquire through our service as to what the best way forward is. And actually the benefit we have is because we also ask a lot of our patients to send photographs. Yeah. Then it is very common that quite a lot of us will come together and might suggest either that they go and see RuthAnn for physical therapy, or some of them might be benefiting from either laser, needling, or a scar revision. Yeah. So I think there are multiple facets to the answer, and it really very much depends on the type of surgery they had and also their skin type.
Yes, yeah.
I don't know if you have any thoughts on that, RuthAnn.
Yeah, I think this is such an important area because there are a lot of people, very clever people like surgeons, creating a lot of scars by doing extremely important surgeries, whether it's delivering a baby or removing a breast. But they may not have the time to focus on the scar. So they're doing something really important that...
Quite life-saving.
Absolutely. But, the scar often, we find, gets neglected, especially in the acute phase where the whole focus is on, saving life and, a major sort of procedure. But if they were able to get to us, then what we can do is provide that focus on the scar, which needs to start really from the moment that scar is created, through prophylactic, preventative measures, whether it's advising on the best creams, which kind of silicone, if silicone, and then, not doing any kind of massage or anything too invasive at the wrong time. But, for example, Ioannis actually is able to start quite invasive treatments very early as well to be very, very effective. So it's just getting in before a scar is visible with that anticipation of what will happen and to make that scar as good as it potentially ever can be.
And I think that's really important, isn't it? That the prevention of the scar is what you should be thinking about as the patient. Yeah. You have a wound from a procedure, but before you do anything, Dr. Google, buy any fancy creams, or go to somewhere that doesn't have the experts within it, is to actually think about, okay, I have a wound, maybe it's not healing great. The next steps are very important, aren't they? And find that expertise. And you mentioned it, Ioannis, it could be laser that improves it. It could be a revision of that scar. It could be actually massage therapy, but specifically the right type of intervention there, or something like needling. There's so many options, isn't there, for that patient? Absolutely. But it's about them having access to the expertise to make the right decisions.
Yeah, exactly. And that's one of the most thrilling consultations I find when Ioannis and I sit with a patient, is the reassurance. Sometimes that is the most powerful treatment you can provide. You see someone coming in so tense, so concerned, and I love it when you've got someone with a scar that looks like pretty bad. Maybe they've had a road traffic accident or walking into a plane of glass, and it looks really bad to the non-clinical eye. And we can sit with them and say, we're not going to give any false hope, but we can say, no, actually, this is going to look radically different in 3 months. Sometimes, regardless of what we do, we don't want to take credit for the natural healing process.
We just know it's going to be a good outcome.
And we can guide them and say, no, you don't need to worry about this, that, because, there's so much panic, really, when you've got a scar, especially on your face. You don't know what to do, what it's going to look like in 6 months. Whereas, we've been through that journey before with other patients, so we understand.
And I think that's so important. And you mentioned earlier about skin types and going back to those surgical incisions, particularly us girls who may have had to have cesareans and ladies that have chosen to have tummy tucks, and the guys, but I know, statistically there's more women having abdominal type surgery. A lot of the questions we get asked, women of colour often have keloid scars, and I know they're very difficult to manage, have a bit of a life of their own by the sound of it. But what would your advice be there, Ioannis, with that type of scar?
Well,
and what is a keloid?
Well, so essentially keloid is a bulky scar which very typically has a mushroom-like appearance. So it's sticking out significantly from the skin level. And the main characteristic of it is that its behavior is quite unruly. So very frequently, patients will develop a keloid scar many months or years following injury to the skin or surgery. And actually, it is a type of skin disorder that a lot of our colleagues are very reluctant to treat, simply because keloid scars tend to come back after treatment. Just to cut the long story short, there are lots of different ways of managing keloid scars, and this ranges from administering steroids, from using laser sometimes in association with medication. One of the mainstays of treatment also includes removing the keloid scar, creating a fresh scar that has a wavy line configuration, and then following on with radiotherapy. And the combination of surgery and radiotherapy can give success rates of up to 96%, which is quite significant.
That's very significant, yeah. Because I think that whole point about skin types and the age of the skin and the type of the skin, that has a massive bearing, doesn't it, on how that wound heals and becomes a scar.
Yeah. And maybe I could just say something about expectation, because I think through the interview I'm aware that we've been careful not to sort of give false hope and to manage people's expectations, because you can go to many clinics and be promised the world and come away with nothing. So we do really, it's important that we're a safe place, that we give honest aspirations about what we can do and often what we can't do, or what, as I said earlier, the body will do without us.
Yeah.
But I think in that context, it is important. And we're talking about, you can't remove scars. But as Ioannis just said with the keloid treatment, I've seen some of his keloids literally, I shouldn't use the word, but disappear. So it's important to recognize, particularly for people with scars, because, it's a life-changing event sometimes. There is so much hope. It's not like we don't think we can't radically change your scar. And both of us, I think, believe that the future is scarless. Probably one day, there are people working on it at the moment, aren't there, to enable healing without scars.
Yeah.
So although we want to be conservative and cautious in a way, what drives us actually is that there must be more. Yeah. Because we've seen people with scars, how profoundly they're affected, and we want to keep finding solutions so that they're not affected by a scar. And maybe one day a scar will have a different meaning. Maybe a scar won't even exist, but we definitely will find a solution if we can.
And I think for me, just listening to both of you, it is a safe place here. And I think, not just here, but anywhere where there's this level of professionals and experts, that in itself is an incredible place to start as a patient. and that there is hope. There are
Absolutely.
so many options, as both of you have described, to improve that scar. And for me, that's really important. And actually one of the reasons why I'm so proud to be here is because of the Scar Clinic, and that we can give patients that level of hope and a safe space for them to get better with their scar. But I think what's also really important, and you've touched on this a lot today, is that, don't just self-medicate, don't just read something and start doing it, but seek some good advice from an expert with lots of experience in the management of scars, and then decide what you want to do next. I think would be something I'd want our audience to be really clear on, because they can do more damage than good some of the time. Well, thank you so much to both of you for joining me today. I could talk to you for hours, and hopefully we'll get to talk again. But for now, thank you so much. Thank you.
Thank you.